So I would like to introduce today Dr. Kelli Bethel. Very, very excited to have her here. Dr. Kelli Bethel is a practicing physical therapist with over 27 years of experience and also a certified yoga therapist and registered and experienced as a yoga instructor. Dr. Bethel works at the University of Maryland School of Medicine, Center for Integrative Medicine, and owns a yoga and wellness practice, which is a private practice. She has extensive experience as a physical therapist, treating both adult and pediatric clients, focusing on neurological injuries and disease, as well as patients with cancer. Dr. Bethel has been working in the field of yoga therapy since 2007 with an emphasis on stroke, brain injury, and cancer. Dr. Bethel designed and operates the Yoga for Stroke Brain Injury program. This program is currently offered at the University of Maryland, Baltimore, the Washington Medical Center, and the program is actually a post-rehabilitation program for survivors with stroke and traumatic brain injury. She works directly with patients and their families and staff to develop and implement patient-centered treatment plans working within the scope of practice and ethics of the State of Maryland Physical Therapy and International Association of Yoga. So welcome, Dr. Bethel. Please let the group know if I've missed anything in your introduction, and please feel free to.
You got it.
Wonderful. Thank you. Welcome. And we look forward to your presentation.
I think you got it perfectly. So I'm Kelli Bethel. I run the Yoga for Stroke Survivors program. I am living in Annapolis, Maryland. I do talk really fast sometimes. So if I start going too fast, feel free to tell me to slow down. My students are used to that. They tell me to stop and slow down a bunch. I have on the call tonight, Christine Neasley, who is one of our stroke survivors in our program. So Christine's gonna talk to you as we go through our presentation on how yoga has benefited her. She's also went through our 200-hour teacher training program at the School of Medicine and is now a certified teacher. So she's actually gonna help me teach a bit tonight. So I wanted, Christine's on the call. And then just if you see Susan Whelan on the bottom is muted and we don't see her. She is the director of Cochrane for integrative medicine at the center. She runs the Cochrane Review site. So she is newer to yoga. And we have a couple Emory PTs who are working with Susan and me and another PT on a review, a systematic review. So she hopped on to kind of see what I'm all about and what I'm doing, because she's a wonderful support of what we do. So I'm going to hopefully can share my screen. So where we're going, my program is Yoga for Stroke, but we really are open to traumatic brain injury, acquired brain injury. But my program is through both hospital programs are actually through stroke services. I meet their joint commission requirements. So the title is Yoga for Stroke, but we really are open to everyone. Let me find my arrow here. Okay. So you've already heard all about me. I'm actually been in PT practice now for 28 years, and my background is very strong in adult and pediatric neuro. I've been doing cancer more recently because I was asked to, and so that's been in the last 5 or 6 years, but those are really the two areas that I work in. So I want to talk first a little bit about what is yoga therapy. We'll talk a little bit about integrative medicine because it's really important to me that while we're talking about yoga and all the benefits that it has for someone who has had a stroke, I want to be very clear that it's not meant to replace PT, speech, the other things that you need. We're really an integrative medicine practice. We'll go through some of the research on yoga. I'll talk to you about the protocol. We'll go through some of the results that we've had, and Christine will share we'll talk to you about her experience in yoga. And then I'll talk to you about what we're doing now that we're in COVID land. In Maryland, we are still not very open. We're not seeing patients in groups. I'm actually in telehealth. I will probably be in telehealth till May of 2021. We're actually not even supposed to be up on campus right now. So how are we going to handle that and still have the stroke program? So I'll talk to you a little bit about that. And then we're going to have an experience. We're going to do a chair class today, and we'll run through all, you guys will get the experience of yoga. So really what I want to talk to you first about is, what is yoga therapy? So yoga therapy is different than just showing up and taking a yoga class. In yoga therapy, we really are applying the principles and practices of yoga in a therapeutic relationship, like we would with PT. There's an assessment, we set goals, we work on things like meaning and purpose. And really we work with either individuals or small group. I much prefer to work in small groups with stroke survivors. I feel like you all have done enough PT one-on-one, and really the benefit of a group, even if you don't do any yoga pose, is far more beneficial than you and I working one-on-one together. So it's not, when someone comes into our program, they're evaluated. I know what their goals are. Some of them stay with me. Christine can tell you how long she's been with me. We're in our 13th, 14th year at GBMC in this program, and I still have a couple of the original people who started with us. We don't kick you out. You stay for, it's a yoga class. But we are really applying principles based on what the group needs, as opposed to me going, oh, I feel like teaching shoulders today, so I'm gonna just teach a shoulder class. So there's a reason why I'm choosing practices. And then I just want to talk a little bit about what integrative medicine is and how it's different. So allopathic medicine, when you hear that term, these are your medical doctors, your allied health professionals, your nurse, your PTs, those type things. Sometimes you'll hear the term complementary medicine. So that's when you might work with me, and I might do some yoga with you, and I'm also working with your PT. And so it's a complementary medicine practice. It's working alongside the standardized medical care. Alternative medicine is something completely different. That's where you decide, I'm not going to see my doctor, but I'm going to do something else that's not accepted practice to treat my stroke. And I've had clients who have done that. They're a bunch, but what I really focus on is integrative medicine. And that's really where I am looking at a client as the whole person. In PT, we may call that the biopsychosocial spiritual model, but really we're looking at everything, the mental, the emotional. I'm looking at your functional capabilities. I still care if you can get on and off the floor, or how fast you can walk, or if you're using assistive device. We also talk about the spiritual side, and a lot of times people think, oh, yoga is spiritual. When we talk about spiritual, we're talking about the definition of spirituality in terms of finding meaning and purpose. So one of my goals as a yoga therapist is, as you are returning from rehab and you're coming to me, and now you're going back to your new normal, how do we help you find meaning and purpose in your life? What can we get you back to that brings you joy? And sometimes it's as simple as being able to get on and off the floor to play with your grandkids. Sometimes it's getting back into the community and doing things. And that group dynamic is really important for that. So we're looking at the whole person, not just, oh, you can't move your arm because you have hemiparesis. So I just want to be really clear about that we're not at any point in this conversation, I am not advocating yoga instead of PT, yoga instead of seeing your physicians, yoga for anything, in a standalone without following up with your regular medical care. Okay, so let's talk a little bit about yoga. So I'm sure this is when you heard that you were getting yoga today, this is what you guys thought I was coming to teach you. But really, this isn't what we do in yoga. This is what some people do, but really, I don't even practice this way. So these are my clients. These are my actual patients, and anyone that you see on here has given us full permission to share their photos. So I do want to give that caveat. My students are very generous with their stories, because yoga has helped them so much that they want more people working with stroke survivors and brain injury survivors, as well as more stroke and brain injury survivors taking yoga, because they found so much benefit in it. So really, what is yoga? It's India's oldest and most extensive tradition. And in Eastern cultures, it's very different than we practice here, I will say. And it's actually used to treat a wide variety of medical issues. You can go to the doctor, and they may give you yoga postures to do. About 150 years ago, we brought it across to the Western Hemisphere. And in typical American tradition, we've now completely changed it. So now that it's a gym workout, which is not really what yoga is about. We know that what makes yoga yoga, or how we think it works, is that it's the physical poses. Those are what you always think of when you think of yoga. That's the asana. The breath techniques, which is pranayama, is what we call it in yoga. The meditation or mindfulness practices, and the philosophies. Those are really the 4 pillars that make yoga work. We haven't, as scientists, we'd like to say, oh, it's warrior 1, and that's why you're getting better. Or, oh, it's the breath practice. But really, it's the combination of all of it that we feel is how yoga helps improve someone's health. What yoga is about maximizing your health. It's about helping you feel better. It's about improving your quality of life and meeting your body where it is today, not where it was last week, not where it was 4 years ago, and not where it's going tomorrow. So we're focusing in the present moment. We also are working to listen to our body. We let go of judgment, competition, expectations, and just being in the present moment. One of the biggest things that we know yoga does is it taps into that parasympathetic response and creates that relaxation response, which is really, really important. So we have a number of RCTs, randomized controlled trials. That's the big thing everyone likes to have in healthcare. This is in general. We're going to talk about stroke specifically in a minute, but really there's enough studies now that we know that these are things that we have been able to show that yoga helps with. So strength, flexibility, balance, proprioception, posture, breathing, improved brain function, decreased stress, all the really good things that we want, that helps us stay healthy and well. So these are, again, for whether you've had a stroke or not, that yoga is beneficial for. When we start looking at stroke in particular, or when I went to start creating this protocol, looking at stroke in particular all these years ago, we had 4 studies. The biggest study was 4 people, and it was a case study. Now we have a lot more research. When I went to create my protocol for working with stroke survivors, one of the biggest things that I used was the American Heart Association and Stroke Association scientific statement. And in that statement, it lays out what stroke survivors need to be doing in terms of exercise. So we, as PTs working in healthcare, those of us who work in healthcare, we really need to counsel and encourage our patients to return to physical activity and exercise training. Now, I've been a PT a long time. When I went to PT school, we were told that whatever you got back in the first 6 months, maybe a year, was all you're going to get back, and that was it. We now know that that's not true. I have clients who are 14, 20 years out who still make changes, maybe not big changes like they had before, but still get some return. And we actually send them back to PT for more aggressive PT because they've had changes. I also get some clients who've been sitting too long or not moving, and they're getting secondary effects, side effects, which aren't great. And, things like contractures and weakness. Those guys also need to go back, may need a rehab intervention. We know that we, as a stroke survivor, that aerobic exercise is really important. And while yoga is great, it does not give you the cardiovascular training that you need. So it is really important. And I always counsel my clients that you still need to do some type of aerobic conditioning, something, walking, stationary bike, whatever it is. And oftentimes I will work to help them figure out what that might be and how do we engage them back in some type of exercise. The nice thing we do, one of the things that we do know now, though, is that stroke risk is reduced with regular physical activities. And that's age matched against your age, your sex, or your ethnic background. And that we still can train your trainability, your ability to increase strength, range of motion, cardiovascular fitness is comparable to your healthy matched age counterparts. Because sometimes in PT where we always worry, like I said, I've been doing this a long time, but there was a time where it's like, oh, they're not supposed to be sore. And then we realized we probably weren't training people in a way that is actually that's actually creating muscle strength. So, a little muscular soreness isn't bad. Other things that are really important is that physical activity is the biggest thing to reducing having a secondary stroke, because that is critical. The risk of reoccurrence is high when you've had a stroke. We also know that one of the biggest issues for engaging stroke survivors into or back into the community to exercise is family support and social isolation. So those areas we have to address. And that was one of the big things with working in groups and allowing caregivers to come take our classes was really important, because I know how hard it is to get back out in the community and exercise. Similar to this call, my one group is a very young stroke group. And so for a lot of them, they were working when they've had their stroke. Some of them were the primary breadwinners. Some of them were the ones who the health insurance went through. And so they felt really guilty about taking a yoga class when they've been, in the hospital and having to go to PT for months and months on end. So we really work very hard to make it cost effective, and also to allow caregivers who may be transporting the clients because they can't drive to the program. And then the other thing is that as we know more and more, we need to continue to update our methods on training people. The other places that I pulled stuff from in looking at the PT and looking at literature to create this protocol was fall prevention. We know that while strength and range of motion are great, if you want to improve your balance, you have to do the balance exercises, which I know you all are going to say to me tonight, because we're doing a chair class and not standing, that we're not working on balance. And I'm very far away from you and I don't know any of you. So we're gonna not address balance tonight. One of the other big things that we know is exercise helps with social isolation and depression. So it's really important to move after you've had a stroke. And then again, we have to individualize the program based on what your capabilities are. So depending on how your stroke affected you, you are one person with a stroke, and we can't generalize that just because you had a stroke in the temporal lobe that you are going to present exactly the same way as the person next to you who had the exact same stroke, but they are presenting totally different. Each stroke is unique and everyone's capabilities are unique. When we looked at now, we actually have an OT that does a ton of research on stroke, which I love. We now know that yoga is a great benefit to stroke survivors. We know that it's a useful and powerful adjunct to formal rehab. We also know that we improve quality of life. That goes back to that meaning and purpose that I was talking about. And also we see improvements of mental health for stroke survivors. So similar to what we see in able-bodied non-stroke participants, we're getting the same effects with our stroke survivors using yoga. We know that yoga and mindfulness is clinically valuable, that it helps with physical functioning. Group yoga it can be done both in a medical setting and a community setting. We're kind of a hybrid. We're more of an outpatient setting in a hospital. That it's cost effective. It's much cheaper to run a yoga class than it is to go to PT. And that it can help with fear of falling. I will say anecdotally, that is one of the biggest changes I've seen in my clients is less fear of falling. And we see improved balance. So in a nutshell, we know that yoga is really powerful for the stroke survivor. We know that yoga can address more than just the physical body. And it's the one people come to me because they want to improve their balance or they want to get stronger. But why they stay is not because of that. Often because yoga addresses the social, the emotional, and again, meaning and purpose of the survivor. So we can cover a lot of areas within yoga other than just getting stronger and increasing our range of motion. We know stroke affects family and friends of the survivors as well. So doing something together, like going to yoga, is really helpful. I'm not going to go through everyone's story tonight, but one of my clients, when we went back and asked how yoga has helped them, I was thinking, oh, they're stronger. I'm looking from the PT perspective, and the husband and wife come together and the husband said, our marriage is better. So just because all they do is come to yoga and they go to lunch afterwards, but it gave them an opportunity to do something together that they found really impacted them. And then again, we can work on several areas, right? We can work on breathing. We can work on movement. We know we're tapping into that parasympathetic response and reducing stress. We know we're impacting anxiety and depression. And we can also talk about diet and lifestyle management. So really, yoga is for everybody's body when it's presented in a safe and modified format, and we take into account everyone's capabilities and their medical diagnosis. There are a lot of contraindications with working with stroke survivors. So that is one, again, another reason why we're staying in a chair tonight. I don't know your medical history. I don't know what you can and can't do. So we're going to keep it safe for everyone tonight. So when I created the protocol, there is no cookbook. I couldn't go somewhere and say, oh, let's, what does it say on page 6 for someone who has hemiparesis? Because it just doesn't exist right now. So I really did have to pull in my PT work and my yoga work and create an integrative medicine, a real integrative medicine practice. So the Yoga for Stroke program is offered at two area hospitals. There's the University of Maryland, Baltimore, Washington Medical Center, and then we also offer it at the Greater Baltimore Medical Center. GBMC, which is the one on the bottom, is the oldest program that like I said, one of my clients said we're in our 14th year. I think we're in our 13th year. But we've been there over a decade, I will tell you that. And then UMBWMC has been around for 6 years. Both programs are through community outreach, which means I meet their Joint Commission requirement. GBMC is in a more affluent area. So classes are based on sessions. So it runs about pre-COVID, it's gonna be a little cheaper post-COVID, but pre-COVID, we're $12 a session. So if it's an 8-week session, 8 times 12, we have scholarship for students who can't afford to pay for the class. So Foundation has donated money, and for those that need scholarship, we have scholarship available for that. UMBWMC is in a much underserved population. Those classes run about $6 a class. So a 10-week class would be $60. And again, Foundation can help support that. Both programs pay us at a rate much higher, and they underwrite the cost of the program and pay for the program, the marketing, everything for that. So that's how the programs are actually paid for. One of the problems, and again, I don't know how states to state work, but a lot of my clients, by the time they get to me, have exhausted their PT benefits. So for me to bill PT, first off, as a group, it's really like I think it's hard to. I couldn't do more than groups of 3 here in Maryland. But again, a lot of my clients have exhausted their benefits. Or they've lost their benefits and are waiting for medical assistance to kick in because they're no longer working. So we really haven't had anyone who said they couldn't afford it. We've been able to accommodate. We do have issues with the one program with transportation. That Maryland Mobility is not great. The other program has the county has amazing transportation options, and because I am a PT, they can get free transportation back and forth from their house to me. So that has allowed a lot more clients to take the program because it solved the transportation issue. Now we're virtual, so that's kind of moot, but that when we get back in person, having good transportation is really, really helpful. So when I created the program, it's a Hatha, which is a lineage of yoga, a Hatha-based class. So it's not that hot power vinyasa flow that you see in the gyms, those type things. It's a Hatha-based class. And when I wrote the protocol, it was then reviewed by nurses and PTs and instructors and chief of neuro, chief of surgery at GBMC. We do require physician release, which I was on the fence about, but the chief of neuro insisted that anyone who had any type of cardiac disease, even controlled high blood pressure, needed a physician release. It's been an amazing marketing tool for me. So actually now I don't mind it, but originally I was like, some of our guys are 12 years out, and they were giving me a little bit of flack, but I had no choice. And now I would definitely, it's been a great way to let other people in the community know what we're offering. Everyone is screened and evaluated, so I know what everyone's capabilities are. And then we modify the class based on both the neurologic diagnosis, what their capabilities are, and any past medical history or current medical issues that I need to adapt for. We do take students who have been in outpatient or that are still in outpatient rehab if it's okay with the physician and the therapist. One of our biggest referral sources is also does the BioNS, which is the AFO that's electronic. And so those patients we like to get because the BINS can be really good in yoga, or it could go off on the wrong time and then the leg's doing something different. So it's good, it's nice to work together with that. But if you're still in real outpatient PT and really, we find that people are usually too tired if they've done, 3 or 4 hours of outpatient PT and then try to do the yoga. But we're open to it if everyone's in agreement with it. We typically operate with a 1-to-3, 1-to-5 teacher-student ratio. This is the recommended group ratio. This comes out of research out of Canada. So that's what we work with. All of our teachers are 500-hour RYT trained at minimum. And most of us have a medical background, PT, CIYT, RN, massage therapist. So everyone that I pretty much work with, it works kind of this integrative medicine role. We both have that allopathic and that complementary medicine practice. We work on the perceived exertion scale, which is how hard you're working, either at a 12 or a 3 or 4, depending on which scale you use. And then depending on the program and depending on your schedule, we meet 1 to 2 times a week for an hour and a half. One of the things that we do is that we build in time, similar to what you guys do as a support group, is for an informal discussion. Because as much as you all want to hear me talk, I am not walking your all's walk. And so it's really important that you guys are supporting each other. And we've had some really powerful discussions. It's a safe place like you guys have here. And so we've had some really big discussions. We've had, like I said, a number of my clients are younger, so disability and people, there was a time where everyone's disability, they were trying to cut off their disability. And the bunch of our clients' kids got married at the same time. So how do you find a dress, a mother of the bride dress, when you have an AFO? And are you wearing a heel? And what kind of shoes are you going to wear? And should I go without an AFO? So we had, really important discussions around it. And then, as I said, family members can take the class as space allows. And we typically have space for family members. We do modify for communication deficits. Right and left are hard if you have aphasia. Counting can be hard if you have aphasia. So trying to find ways around what works for each individual person so that we can work, with what works best for you. We are moving from rehab back into life. And so we always have to watch out for that rehab mindset, because what it took to get home is, to get from rehab to home is really, really intense. But sometimes my yoga clients will try to do that real intensity and they're putting themselves at risk or they're overdoing it. So we try to find that balance. We also are very flexible with our class structure. So one of the questions I get is, why have we not done this as a study? Because it's been around a while. One, neither hospital has asked me to, so I'm okay with that. But the other reason is because I need to see what shows up and walks in the door that day. So in Maryland, we are big Ravens fans. And if the Ravens had that 10 o'clock, 10:30 NFL game on the West Coast and it ends at 2 o'clock in the morning, my clients have stayed up and watched it and then come to yoga the next day and they are exhausted. So chances are we aren't going to do any standing. They're big Oriole fans too. So, those type of things, we have to adjust the flexibility with the class structure. Like Georgia, it's very hot here in August. Typically that affects people's muscle tone. And then same thing when it gets really, really cold. So we evaluate we evaluate kind of everyone when they walk in the door, and then we can adapt on the fly with what we need to teach that day. We did start with a small grant. It was a seed money, and that really paid for us to get the program up and running and allowed us to get marketing and equipment. And then, like I said, we have an in-kind donation of space from GBMC and scholarship, and then BWMC really underwrites the cost of the program. And I do run by sessions. We don't allow drop-in because that allows me to staff it safely. So kind of how we go here, we start with breath, and then we get into the physical movement. Now, a typical class, we're going to be a little different with COVID. I'm going to talk about that in a second. Is we get on the floor. Sometimes we'll get on our stomachs. That's kind of hard depending on who's in the class and how much tone or lack of movement they may have in the shoulder. Then we come into sitting, either on the floor or the chair, and then we do standing, and then we'll come back down and do some deeper stretches. Shavasana is the final pose that we do. And that really is where you just lay there. And people often are like, oh, that's like, we just lay there. But really from a neuroplasticity standpoint, that pause is really important because it allows everything we've just done to integrate. So Shavasana is really a really important pose. And my students who I teach know that I taught one of my courses is meeting, and they're like, so Kelly, what happens if we don't do Shavasana? And I was like, a piece of my heart dies. So it's a really powerful and really important pose. And then we usually follow with some meditations. We follow, of course, the exercise guidelines, the accepted exercise guidelines for stroke. We weave our lifestyle and ethics through our classes. And then the GBMC group likes to journal. My BWMC group does not like to journal. So journaling is on a location by location basis. Kind of some our results that we've seen. So because I'm through the hospital, I have to go through Joint Commission, which is always very stressful. But we've noticed changes in posture. Cheryl, who's here, actually grew an inch. She didn't really grow an inch, but she was no longer flexed, and she was up. She could actually stand up straight. She was standing up straight. Her posture was better, and she actually, by measurement, had grown an inch. We've seen changes in tone. My clients can use breath practice and mindfulness to help negate some of their tone. We've seen changes in strength, improved flexibility, breath control. Transfers on and off the floor is huge, and you'll see that in a minute with the video. Better range of motion, improved core, relaxation responses, improved mood, and decreased fear of falling. And balance is probably the biggest reason both my stroke and my cancer people come to work with me. So how are we handling COVID? So we're back. We're starting in 2 weeks. We did a little bit through Facebook, and people were like, oh, this is great. Everyone was hoping we'd be back in person in the fall, and that's just not going to happen. Both classes meet on the hospital campus, and we are nowhere near phase 3, which allows us to have these type of meetings on campus. So we're going online through Zoom. New clients will be screened virtually. And really what we've had to do is follow where the PT world is right now with fall prevention literature that they're offering virtually. We don't have a lot of studies yet that really show how to do this. We're kind of, helping each other out here. But the first round of virtual fall prevention programs have gone through the summer, and the APTA, the American Physical Therapy Geriatrics section, spoke on their results. And so we are going to have 2 classes. One will be a chair class, and one will be more the traditional class that I just went through. In order for clients to take that more traditional class, they have to be independent to be able to get in and out of the chair for standing. And cognition could play a part in it, not so much with the group that I have right now, but really if you can get in and out of the chair independently, then we will put you through to the standing class. There's a few other things that we're going to look at prior to being admitted into the class that does a lot of standing. But otherwise, we're offering a chair class. If you need assistance and there's no one there to help you get on and off the floor while we're virtual, then chances are we'll either modify what we're teaching. So I know in conversations with you, you're pretty mobile. So we have a couple students who are fine sit to stand, fine standing, on and off the floor. They need help. So we may keep them in the chair as opposed to offering them on and off the floor. Any time, even if we're in person, we may have 6 people doing 6 different versions of the yoga pose because their medical or their capabilities have some type of contraindication. And so therefore we have to modify for each of them. And that's why I usually have 2 or 3 people in the classroom teaching the course with whoever the lead teacher is. So that's why it's important to screen everyone, because and that's what makes it different than just showing up at a yoga class and being like, I'm here, let's do yoga. We really are, since we know who's coming in, we actually can write the class and make the class so that it works for you. So we're virtual. These are our 2 locations. I gave a talk last week that was open to the public, and all my students showed up, and we got totally off topic because all they wanted to talk about was coming back together. So I think everyone's ready to come back together, even if it is in virtual land. And I will say that was the one thing, as you guys are looking at doing some of this, maybe something similar down in Georgia, is that even virtual, the people that presented in the APTA workshop said that while it wasn't perfect, they were so happy to be back together and to actually be in a group that outweighed any of the less than perfect, situation that, we're not in person.
Body Harmony's yoga for stroke survivors is to improve a stroker's health. Being a yoga class that is safe, therapeutic, to overcome disabilities that result from stroke.
I did physical therapy. I plateaued out about after 2 years, and I began yoga. And actually, since I started yoga, I've combined it with going to the gym. The two really need to work together because you need that core strength I've learned through yoga to be able to walk properly and stand properly. That's your main thing, is getting your core nice and tight, and doesn't work unless you do both together.
To get up and down, so much easier. Where I used to have a much harder time when I would get down on the floor for any reason before. It would take so much more effort for me to get up. My balance has improved greatly.
I started in September a year ago. I was on a yoga table because I was not able to get down and up. I'm able to get down on the floor and up by myself, which is huge. And I can carry that over to my home life with my grandchildren. I'm able now to get on the floor and play.
Amazing that I can do it, to get up and down are really good. Not the getting up so good. That's still kind of hard, but going down, it's very good.
I've learned a lot from yoga. I've learned how to try to relax, and I think that the different poses and the stretching and everything has just really strengthened my body.
Began to move, I'm being able to feel different parts of my body, and I recommend this to everybody.
Body Harmony Yoga is taught at a slow and gentle pace in the Hatha Yoga tradition. All classes are taught by registered yoga instructors. Class sizes are limited to a 1:3 to 1:5 teacher-student ratio.
At first, she was a little hesitant. It was a good thing that Kelli came out for the one-on-one the first time. Yeah. And he actually had you getting up off the floor, showing you a technique to use to get up off the floor. And then when you came to yoga, they were working on those activities so you strengthen more with the core and with your legs. Got a little bit of more flexibility, but the biggest thing that I noticed was the confidence. You were willing to work and do it on your own. I mean, you always had the drive. You were always
Body Harmony program incorporates breathwork, yoga poses, and mindfulness. Additional time.
The breathing aspect.
I have a breathing and swallowing issue, and yoga teaches just relax breathing. I started practice yoga after my first stroke, 2006. Several teachers would guide me safely and showed right poses. Now, I very enjoy yoga and enlightening positive philosophy. I like my classmates, and it is most important.
Ongoing physical activity is recommended for stroke survivors following rehabilitation. Research studies continue to support yoga as a beneficial method to stroke survivors as a means of helping them continue their recovery.
So that's my group at GBMC. And like I said, they're very sharing of their stories because it's been so beneficial for them, and want more people, want to get the word out how much it's helped them for stroke survivors, and also getting more teachers trained to actually be able to work with stroke survivors, which is part of my work that I do outside of here. I think that's everything. Yeah. So I want to introduce you to Christine. Christine Neasley. Her name was spelled wrong in the video, and that video was shot. That was shot a long time ago. So I still have a lot. Everyone's still. I still have the same group. They're all still coming. We get new people, but the core group continues to come. Sean's still there, and everyone that's in that video is still there. But I want to introduce Christine Neasley. Christine, I'm going to stop my share. Christine is one of our stroke survivors, and like I said, she's now also she's gone through our teacher training program and is now actually a yoga teacher. And she can tell you about what yoga has, how it's benefited her.
All right, thank you, Kelly. And actually, I sustained a severe traumatic brain injury in February of 2010, and I had, in January of 2012, I'd been discharged from my second outpatient rehabilitation program. And, but I still was feeling the need for more assistance toward improvement. I know you guys may feel, I mean, everyone's different as we all know, in our recovery from brain injury. And I needed more. And I went to a regular yoga class, and the teacher at the time asked, does anybody have any concerns? And I shared my issue, and she helped me do some adaptations, but I knew that I couldn't spend going to every single yoga class dealing with having to adapt for one thing, I wouldn't be able to remember how to adapt. And I couldn't ask the teacher to adapt the class to me. So I was like, there's got to be some other way. And somehow I came upon Kelly's Yoga for Stroke class at GBMC. So I got in touch with her and I said, I didn't have a stroke, but I had a brain injury. Would I be allowed to take your class? And she said, yeah, come on board. And the rest is history. So in the spring of 2012, I was welcomed into that group, and it was just life altering, really. I mean, it was able to bring me back in touch with my body, back in touch with what I was physically experiencing, and I was able to recognize the emotions I had, that these sensations from my physical experience, what came from those physical sensations, and helped me realize just how disconnected I had been during from the injury, and from the first 2 years of recovery, just how disconnected I was. And it wasn't until the process of yoga was, kind of bringing me back together, and allowing me to just take what I learned in the class off the mat and carry it beside me every day. And it was a way to support with me, and for each day's hurdles. And sometimes, one of the best response is to just simply stop and to breathe, and to realize that, like, that's all you need to do, instead of react. And so, acquired brain injury and trauma often block access to one's awareness and sense of self. And this circumstance can make it difficult to define what you need, and it really leaves you vulnerable and unable to self-advocate. So yoga therapy offers a way into those thought processes from the bottom up. It's your kind of like our primitive brain, just the way we were programmed. And once you access that intuitive process of self-awareness, you can take it into every single day. And it works wonders as a complementary tool alongside the higher level therapies, speech language pathology, or psychotherapy. I noticed a huge difference because I was still in the process of going through those therapies. And it really just helped foster and bolster me through that. And I noticed a huge improvement in that process. It allowed me to be more collaborative and more productive, and which led to a more informed rehabilitation. So because of that whole experience, I just like what Kelly was saying, I just was singing its praises, and I wanted to kind of share that with other survivors so that they might benefit the way I did. So that's why I took the yoga teacher training program, and coming in this spring of 2021, I'm in the process of applying to University of Maryland School of Social Work, and I hope to combine yoga therapy and talk therapy in one setting to work with acquired brain injury and trauma survivors, and hope to utilize the integrative practice so that I can help people find their individual way of flourishing and transformation while in the process of recovery. It's given me kind of a restart, and who would have thought, but it's really boosted my, I feel like I've been given a second chance. So.
Awesome.
That's my story.
Wow.
So we are so proud of Christine, and her story is amazing, and the group at GBMC is amazing, and that is the one thing, just to watch the support and the network that they have formed is just a beautiful thing to be a part of and to watch, and I'm very lucky because this is something I'm deeply passionate about. So Christine's going to teach us a breath practice in a second. We're going to move into practice. Do you want to ask questions now, or you rather wait to the end? Or maybe you don't have questions. All right, so let me go through the rules of practice.
I think
All right, so I do have some rules. So our rules tonight is, obviously you're not gonna let me know if you had an injury, but if something doesn't start feeling right, please stop what you're doing, either unmute or just stop and breathe. One of the things that we work with in yoga is the concept of ahimsa, which is non-violence to self. So if you know something's a little hard, this is a chair class. We're not going to push ourselves tonight because I'm not there to be behind you, or, we're going to focus on going about 80%. My goal tonight is to tap in really to your breath and help deliver kind of a parasympathetic, a decreased stress response is kind of my goal of tonight's class. Since I don't know you, since I can't see you and don't know all your limits, we're going to ask you to take your time. Work within your known range of motion and flexibility. I'm going to try to give as many modifications as I can. Again, I'm not sure who has hemiparesis, where everyone is, but we'll try to get modifications in for everyone. It's a small enough group, I should be able to see everyone. That's undone. Nothing should hurt. So in yoga, that no pain, no gain doesn't fly. Nothing should hurt, okay? You may need some water afterwards, and we're working on a perceived exertion. We're going slow tonight. So we work on the perceived exertion on a scale of 1 to 10, working in the 3 to 4. Tonight, I really want you like a 2 to 3, which is like not really a lot of work. Again, we're going to really work on that mindfulness piece. One of the things that we know when we pair movement, so I get asked a lot, what is the difference between PT and yoga? Because it feels like we're moving our arms up and down, right? In PT, we move our arms up and down. In yoga, we move our arms up and down. But one of the things that's different in yoga, we pair it with breath. And it becomes a mindful movement, almost a meditative, not almost, it becomes a meditative movement. And the goal really is to tap into that parasympathetic response. So we're going to have a short practice. First thing, the other rule is you have to have a sense of humor because it's just yoga. So we're going to do a couple things tonight that you're going to have to laugh, and it's just the way it goes because, you know, we just get life. We got to have a sense of humor about it. So when I get to the yoga toes, Christine knows how I feel about how much I love my yoga toes. And I'm going to ask that you laugh. See, there was another chat. I just want to make sure I didn't miss anyone. I think that's you, Christine. Okay. So we're going to come up, we're going to stay in a seated position. So I'm going to ask you to kind of get into a good seated position, what we call mountain pose. So if you can, getting your feet flat on the floor, sitting up nice and tall. Caregivers, you are welcome to take class with us. I'm going to slide my tall chair out of the way. So since I'm now in virtual land, my unfinished basement has become my studio. What you can't see is that the ceilings are really low and unfinished, but it looks pretty good on the camera screen. All right, so we're going to sit up nice and tall. You're going to ground into the feet. Now, if you can, and if you're feeling tired today, scoot back so that your butt is against the back of the chair. If you're feeling a little energized and not too tired, I know at night I'm normally getting ready to go to bed at this hour, so it's tiring for me. But we're going to sit up nice and tall. We're going to ground into the feet. And you can keep your eyes opened or closed. Christine's going to take us through a quick breath practice. We're going to practice for about 15 minutes or so. I'm looking at the clock. So Christine, probably like 2 to 3 minutes for breath, and then we'll do some movement.
Okay. All right. So everybody, just either close your eyes or soften your gaze and let your body relax. Feel the breath flowing in and flowing out. Soften your face and jaw and allow the breath to flow smoothly in and out through the nose. Soften the eyes and relax the shoulders. Begin to watch your natural breath patterns. Notice the breath as it comes into your body. Notice, what does this feel like to you? As you inhale, say to yourself, I am breathing in. I know that I am breathing in. And as you exhale, say to yourself, I am breathing out. I know I am breathing out. Continue with this breath. Let it naturally deepen and become slower. Take a moment to notice the sensations in your body. Relax the face as you breathe. Release any tension in your jaw by bringing the upper and lower teeth slightly away from each other. Remove the lines of expression from your forehead by softening your brow. Move into the rest of your body. If you observe any areas of tension or pain, take your breath to those places and release those sensations on your exhale. Feel the weight of your body on the chair. Notice where each point comes in contact with the surface of whatever you are sitting on. Take a breath and soften into these contacts. Now move your awareness down into your feet and your ankles. How do these areas of your body feel? Imagine the breath flowing down your legs and into your ankles and feet, sending life force to your foundation. Now imagine this breath bouncing off the base of your feet and coming up into your calves and your knees. Notice how these parts of your body are feeling. Let the breath work through the kinks and let them melt into the ground. Draw your attention up into your thighs, hips, and pelvis. How do the front and the back of these areas feel? Breathe into any tension you find and release it out on the exhale. Move up into the abdomen and the lower back. Continue to ease any discomfort by using the breath. Shifting into the upper and middle back, the shoulder blades and the chest. Do you find any tightness? Inhale and imagine your breath traveling like water to your upper torso. Exhale and release your shoulder blades down. Let your chest expand and relax. Now imagine the liquid breath flowing from your upper torso down into both of your arms and all the way down into your hands, into each of your fingers. Let this bring to light what you are feeling in both of your arms. Use this knowledge to access release. Bring your awareness back in from your arms up into your neck, shoulders, and collarbone. Be mindful of these areas which are prone to hold tension. Use this opportunity for your breath to relieve any that may be present. Now come back into your face, your mouth, your jaw, your eyes, your forehead. Do you notice any gripping? Breathe into that tension and let it all go. Finally, bring your attention to the top of your head. Inhale here, and exhale to let your head and body be heavy and relaxed. Sit here silently, breathing a few more rounds of breath. Now come back into your body. Wiggle your fingers and toes and be aware of the space you are in. If your eyes are closed, open them and come back into the room.
So from here, we'll begin to get a little bit of movement going. So you can roll a wrist or a finger if that or wrist if that works for you. Opening and closing the hands. And then we're going to start with the shoulders. So even if you don't have full range of motion in your shoulders, even if all you can do is bring your shoulder blades, we're going to bring our shoulder blades back together and forward. So just bringing the shoulder blades back and then drawing them forward. And it's okay if one side doesn't work as well as the other side. If you've got any bit of movement there, that's fine. If not, just do the side that's a little stronger. Okay, good. And then we're going to go to shoulder shrugs. So inhale the shoulders up and exhale down. And again, if one side is a little bit weaker or you just don't have the range of motion, that's fine. Just do the other side. One side might be stronger than the other. Inhaling up and exhaling down. Good. Let's take the hand, and again, your guys are all kind of different things, but take an arm. If you have, don't pull it out, but whatever arm's a stronger arm, thumbs towards the back of the room, nice. Draw the navel in towards spine. Now, do not fall out of the chair. Take an inhale here and exhale, gentle side bend over. We're side stretching here. So you're working with the arm that's the stronger arm right now. Breathe, inhaling in and exhaling out. One more breath. Now bring it down. Now we're going to use the opposite side. If this is your weaker arm and you can't raise it, you're going to hold on at the elbow. Okay, so you're either here or here. You pick what works for you. All right, so inhale here. So I'm going to demonstrate the modified version. Again, bend over to the other side. Don't twist. Come back up. Good. Let's do that again. Let's take the arm, the stronger arm, inhale it up. Exhale, side bend over. Beautiful. You guys look so good. Inhale up, exhale it down. Let's do the other side. So again, you can either hold on at the elbow on your weaker side or bring the arm up. You choose. Inhale here. Exhale, side bend over. Breathing. Do not hold your breath. Good. Come back up. All right, let's play with the feet a little bit. So you guys can't really see I'm going to step back a minute. We're going to lift and spread the toes. The mobility in the feet is really important. So even if your toes on one side is weaker than the other, that's okay, but lift them all up and spread them. And you have to have a sense of humor here, and then release them down. Good, and then lift and spread them again. I'm good. You guys are sitting. I'm just standing so you can see my feet. Good, and then release them down. And then try to lift just the big toe up. Good, and release them down. And now lift all four up and keep the big toe down. Those are yoga toes. Tap them out. All right, let's do a little bit with our hips. So again, breath with movement here. This is similar to probably a PT exercise that you've done. It's simple marching. I want your upper body still, and you're just moving the hips if you can. Again, if your one side is too weak to lift, no big deal. Do what you can. So let's take the stronger leg. We're going to inhale it up and exhale it down. Breath with movement. Good. I'm going to turn to the side. You see I'm not moving. Now take the weaker side. Inhale it up. Exhale it down. Let's go again. Stronger side. Inhale up. Exhale down. Other side. Inhaling up and exhaling down. One more each way. Inhale up. Exhale down. Last time this side. Inhale up. Exhale down. Good. Let's bring our arms out to a T position. Good. Yep. Beautiful. Good. All right. So this is what I call stop in the name of love pose. So you're in a T, wide. Let's just roll if you can the hands. Make it roll in the wrists. That'll work. Good. Now I call this stop in the name of love. Bring the wrist back towards your face. Nice. Good. And then bring your wrist down. And again, if you've been on the computer all day, this feels really good. Inhaling up. Good. Exhaling down. One more time. Inhaling up. Good. Exhaling down. You can roll the shoulders. All right, we're going to take genie arms. So we're going to take your stronger arm and you're going to place it right in front of you. So it's going to be right like in the, yep, perfect. Good. Weaker arm goes on top. Good. Stack the hands are right on top of the elbows. So put a little bit of energy into the top and bottom so you're kind of making that sandwich. Sit up nice and tall and lift up. So you're working the shoulders. Nice. Bring it back down. Good. Now we're going to add a little bit of twist. So you're like that genie. Some of you may remember I Dream a Genie. We're going to keep our sit bones, our butt glued to the chair, but we're going to gently twist to the left. Good. And we're going to come back to center. Good. And we're going to go to the right. Good. And we're going to come back to center. And now we're going to roll and come out of it. Nice. All right, couple more poses and then we'll just do, I always run out of time. Bring the arms out again to that T position. So these are what we call warrior two arms, right? We have warrior two as a pose in yoga. Now, keep your sit bones where they are and just gently. So think about like when you're too lazy, this is called I'm too lazy to get out of bed pose. Yes, I've made these up. Think about when you're too late to get out of bed and you reach for something off that side table without falling out. So do not fall off your chair. Keep your sit bones down, but let's lean to the left. Good, and come back to center, and we're going to lead to the right. Good, come back to center and release the arms, roll the shoulders. We're going to come back to that in a second. All right, arms again, right out to that T position, warrior two arms. Let's again reach to the left. Good. Now turn the palms to jazz hands. And then come into triangle pose. Beautiful. Nice. Good. Come back up. Turn the palms down. And again, reach now to the other side. This would be my right. Turn the palms up to jazz hands. Good. And come into triangle pose. And again, that nice stretch across the pecs. Good. Come back up. Release the arms. Good. All right, take the right leg. Actually, let's do this. Take your stronger leg, send it out in front. Leg is long if you can get it long. Now, if the back of the muscles on your back of your leg are really tight, this may be hard for you. Ideally, I'd like the foot, I'm going to turn sideways so you can see me. Ideally, I'd like the foot turned up if you can. Good. Now, here you're going to just gently hip hinge. You're not going to fold too far, but just get a little bit of stretch of that hamstring. Lead from your hips, not from your head. Good. And come back up. Bring the foot back. Let's send the other leg long. And again, if the tone in your leg does not allow you to fully extend, that's fine. Go within your available range. Hinging at the hips, gentle fold over. Just get a little bit of stretch of that hamstring. Nice. And come back up. All right, we're just going to finish. We'll finish with a little bit of guided meditation in Shavasana. So you can be comfortable however you want. But I want you just to close your eyes if that's okay for you. And in your mind, I want you to picture your most favorite place. It can be anywhere at all. And in your favorite place, notice the colors and the textures. What smells do you smell? What sounds do you hear? In this favorite place of yours, there's a really big, comfortable chair. And just have a seat. And just spend a few minutes in your favorite place. I'll bring you out in a second. Just allowing the work that we've done. And just finding peace in this place. Just beginning to notice the sounds in the distance. Begin to noticing the most distant sounds that you can hear. And then beginning to notice the sounds inside the room. Visualize the four walls, the ceiling, and just see yourself sitting in the room. And then when you're ready, deepening the breath, coming back into the present moment, wiggling the fingers, the toes, and just slowly bringing yourself back. We close our yoga classes with the word namaste, which means the light in me honors the light in you. So namaste. Thank you for letting me share my passion. And thanks, Christine, for sharing your story. I really appreciate it.